It's another day of poor air quality in the city of Toronto, and today we're learning more on how that smoke not only impacts your lungs, but also your brain. With more on this, we're joined by Baycrest Chief Scientist, Dr. Allison Sekuler. Thank you so much for being with us today. Really important to talk about the impacts as we've been seeing more air quality warnings in our regions particularly. And usually we talk about the lungs, as I said, but also the brain is important. Yeah. What impacts does wildfire smoke have on our brains?
Yeah, it's funny because a lot of people think that smoke is just impacting the lungs, but it is actually also having an impact on our brains, and it's actually a risk for dementia. And you think about some of the things that normally would be thought of as risk for dementia, like obesity or stroke, but air pollution actually is a known risk for dementia. And wildfire smoke is actually more of a risk than normal kinds of everyday air pollution we might see in the city.
So how worried should we be about this?
Well, it's just one of a number of different kinds of risk factors. So absolutely, any kind of risk factor you don't want to ignore just because it's not the most important one. If there's something you can do about it, do something about it. So if you're checking the air quality health index and it says it's 7 or higher, absolutely try to limit your time outside. But even where it is today, it's like 5. I'm not going to be spending a lot of time outside. If I am spending time outside, I will try to wear a mask, a fitted one of those masks that everyone was wearing during the pandemic, the N95 masks. Because what's important is to try to keep those tiny, tiny particles out of your system. That's what's getting into your lungs and through your lungs into your bloodstream and then into your brain. And sometimes they're so small, especially from wildfire, that they can actually come straight into your brain.
I want to highlight what you just said that right there, because I think it's important for people to take home the mitigating factors here. I saw a lot of people wearing masks yesterday, so you said that is helpful, and then you stay inside as much as possible. What other steps do you think folks should be taking on days like even today?
Limit whatever exercise you need to do outside or any time outside for sure. Check what the air quality is, because sometimes, like today, I could see it. It looked bad. Yeah. But there are some days where it actually is bad, but you don't see it. So I always check the air quality health index on my weather app or my, whatever app you're using, and it'll tell you, is it moderate risk, is it low risk, is it high risk? Anytime it's sort of moderate, I will start to reduce the activities I'm doing outside. And high, absolutely, or very high, I'm not doing anything outside unless I absolutely have to, and then absolutely wearing a really well-fitted mask. And one of the things that people don't realize is that if they don't seal their homes well, then they will get this air pollution seeping into their house. And again, you can't see it. It's so tiny. Like these particles that are coming out of the wildfire, you can fit more than 30 of them on the width of a human hair.
So when folks are outside, let's say maybe they're not keeping a close eye on their phone, and that usually tells you where the air quality index is at. What sort of signs should they be looking out for to kind of limit their activities outside on days like?
If you see everyone else wearing a mask, then that's a sign. But also sometimes you will feel, I have to say, I want to fix the filtering in my house, because yesterday in my house, my eyes were feeling like dry and hurting. And other people, even inside, were feeling like their throats were scratchy. So if you're starting to feel any of those sorts of symptoms, then that's a good sign that the air quality is bad and stuff is getting in, even if you can't see it.
Dr. Allison Sekuler, thank you so much. Great chatting with you.
Thanks.